Hello, I'm Paul Kagabine with the Garland County Library in Hot Springs, and today is February 4th, and I'm with Garland County Health Officer Gene Shelby, who is going to give his latest progress report on the current state of the COVID-19 pandemic here in Garland County, and then he's going to follow up with some answers to any questions from both you live viewers and myself. So while Dr. Shelby starts with his update, if you're thinking of any questions about any and all things COVID, please don't hesitate to drop them in the comments as always. So, all right, Dr. Shelby, I'll let you get started.
Okay, thank you, Paul. Appreciate you having these series of discussions about the COVID epidemic or pandemic that we're facing here in Garland County. I know it's been quite several months that we've gone through this, and we've still got some tough roads ahead. So what I'd like to do is just kind of outline a little bit what we've been doing here in Garland County, and then kind of looking forward to what we're going to be facing in the months ahead. My position as the Garland County Health Officer, it's a voluntary position, appointed or recommended by the county judge and appointed by the Secretary of Health in the Arkansas Department of Health. And I've served in this role for about 20 years. Of course, it's been a lot more active role this year with the pandemic. One of the good things that we did here in Garland County back in really the first week of March, we formed a task force to address the pandemic here, and it was made up of representatives from county government, city government, people in the health, representatives from the hospitals, as well as the Department of Emergency Management and our local health unit. But we meet on a weekly basis by Zoom on Monday mornings to kind of share what's going on in different aspects of our management or effort to move forward with this pandemic. One of the things that I do at each one of these meetings is I make a presentation about where we're standing in terms of our cases, and then kind of put it in kind of a perspective of where I think or where we are headed and where I think that we will be headed in the future. And it's amazing to kind of look back on the numbers, look back on even towards the end of April of last year, that we only had like 4 positive cases during that time, and for really until the end of May, we were seeing up to a maximum of 10 new cases per week. And obviously things have exploded from there with our first big peak coming after the Memorial Day weekend, and subsequent had spikes the 4th of July, Labor Day, and then we had the big spikes after Thanksgiving and then Christmas and New Year's. Unfortunately, then in January, it's been a much better month for us in terms of our cases. We really peaked probably between January 10th and January 15th in terms of the number of new cases that we've had. And unfortunately, we have developed a downward trend in our cases over the past 3 weeks, with pretty significant declines in both the new cases and the active cases, and that we've seen. Just I'll give some examples. On the week ending January 17th, we had 815 new cases, and by the week ending January 31st, we were down to 383 new cases, and we had kind of peaked at 841 active cases, and by the end of last week, we were down to 589. So we had a good downward trend. Unfortunately, this week we're starting to see an uptick. We don't have the final numbers in for this week yet, but we're definitely going to be up from the last week. And again, I hope what we've done in the past is that when we were going up, we would hit a plateau, and I'm hopeful that we may be in the plateau phase and not another spike. One of the things that I look at, and again, the good trend we had was the average number of cases on a daily basis per week, and we had a high of 116 new cases per day during the week of January 17th, and it was down to 54 this past week. And our positivity rate has also had a decline. It was up as high as 15 or 16%. And this past week, it was down to 13%. So those were all good trends. One thing that we have noticed, and I think we'll probably continue to notice, is the increase in deaths. That's because, I mean, we still have a lot of virus in the community, and the deaths tend to be a lagging indicator of disease. And we're up to 211 deaths in our county, which I think some of that reflects the fact that we do have an older population, and that's where the deaths occur. 70% of the deaths are in people that are 65 years of age or older. One of the things I also look at is the distribution around the county, and it's pretty widespread in terms of different areas. We did have a spike in the Garland County portion of Hot Springs Village, but that has been declining, and we've seen declines around the other areas like Piercy and Royal that have seen good declines. And in terms of where we are in the vaccination program, of course that's going to be a real key to ending the pandemic, and we're still in the early stages of the vaccination program due to the limited amount of vaccine that we get into the county. Of course, we started in January with the one, it was kind of considered phase 1A of the vaccination program. And that was mainly to healthcare workers and first responders. So the governor opened it up to the early stages of phase 1B in January, which in the portion of 1B that are being vaccinated is people that are 70 years of age and older, and the educators. And I think I know we're off to a really good start in terms of getting our educators vaccinated. That we've had vaccination clinics, I believe, at each of the 7 school districts in Garland County, and have had pretty good turnouts at those. And so we're making some good progress there, though it's ongoing. As you see on the screen, it lists the different phases. And like I say, we are in phase 1B, and it's predicted that we will still be in 1B through March, and not really get to a more broader group that are reflected in 1C until April. Again, one of the frustrations that we're feeling here, as well as around the state and around the country, is the uncertainty about how much vaccine we'll get in the time frame of when we're going to get it. As far as most in the phase in 1A, a lot of it was from the hospitals. The hospitals were given the vaccine directly so that they could immunize all of the healthcare workers in the hospital or affiliated with hospitals. And then we were able to have some clinics to get the non-hospital affiliated healthcare workers, such as dental offices, to get those vaccinations. I think we've done a good progress with that. As far as the portion of in phase 1B, it's really a much more difficult group to give because it's kind of spread out, especially with the people in the 70 and above. We are doing some kind of large vaccination programs. We had our first one on Tuesday, and we've had a really good joint venture with the county and the city and some various organizations. And we have a really nice facility set up at the fairgrounds out on Highway 70 where we were able to have people able to register and have their vaccine given without having to get out of their car. We were originally planning on the vaccination program that we had on Tuesday. Originally, we were told that we would have 1,000 doses of vaccine, but at the end of last week, we were informed that we were only going to get 400. But it really turned out to be a good thing in that we were able to really fine-tune how we were going to run the program, and I think we, from everything I'm hearing, things went smoothly in terms of vaccinating the 400 people, and hopefully the next one we have, which should be sometime next week, we will have between 1,000 and 2,000 doses to really do a much more access to, especially to the people that are 70 and above. So I think, one of the things that we are also trying to really promote is how vital the vaccination program is in terms of stopping this pandemic. But it's going to take a lot more vaccine than we have now, and a lot more participation in order to get to the 50 to 60% of people vaccinated, which was what it'll take, what we feel like it's going to take to really kind of end the pandemic. But we feel good that we're in a good place as far as moving towards that. There's some things that I'd like to really emphasize, that even when people are vaccinated, it doesn't really change what people are expected to do. The mask and the social distancing and the hand washing are still as important as they ever were, and the fact that people are getting vaccinated is really not. I don't think it's really affecting the number of cases that we're having at this point. I think that our decline in cases is more related to the very few really big social events occurring in the month of January. So we're going to have to, continue doing the things that we do. I have some concerns about this weekend coming up, with it being the Super Bowl Sunday, which normally we do have a lot of congregate events, watch parties, and gatherings, and those are just really not going to be safe to have this year. And the recommendations from the state and federal government is that it should not have more than 10 people in an enclosed area, and it needs to be large enough that they can keep the 6 feet separation, and then masks are vitally important to prevent further spread. So we'll just have to hope that people are following these recommendations so that we don't get an upward trend or another spike in the coming few weeks. So that's kind of the summary of where we stand here in Garland County in terms of our dealing with the pandemic. Again, we've really had it's been a really good community effort with a lot of people really stepping forward to work on this, and really we have a good community spirit. Our local health unit, is doing testing, and at some point may start actually doing some vaccinations. But currently, there are no vaccinations being given at the county health unit, but they can definitely. We've got some great staff there that can help direct people that have questions. We still have our our call center that's being managed by the Janice Ivers and the nursing program at National Park College. And it's very active for people that want to talk to someone locally and get some answers and ideas. And we're going to show that as far as people are concerned about how they can get in line to get the vaccinations. Like I say, we're still in the early stages of 1B. Actually, the city of Hot Springs has a very good page devoted to the COVID pandemic on their website, and it lists all the different pharmacies and organizations that are involved in the vaccination program, and has links to the different pharmacies that have waiting lists for people to get get set up to have the vaccination. So I really encourage people that have questions or concerns or and need some direction on how to move forward to get their vaccine to visit the city's website. So that's pretty much what I wanted to get out to start with, and be ready to see if I can answer some questions we might have.
Absolutely. Thank you, Dr. Shelby. So we did get a couple questions just now about what you were talking about before we move too far away from that. Deborah, first of all, thanks you for all your hard work. And she asked, do people in the C group need to go ahead and sign up somewhere?
To my knowledge, there's not a place that is accepting people to sign up there in the C group. But you could check again. There be at some point a sign up for it, and you can certainly check on the pharmacy websites that are listed on the city's website to see if any of them have opened it up to people in 1C. To my knowledge, they haven't. But it's one thing that I think we've all learned about this. Things change pretty rapidly, and so it's hard to know exactly where things stand at any given moment.
And John asked, how can we find out when vaccines are available for 70 plus?
Well, in the 70 plus group, it's mainly been people that are signing up through the pharmacies. Also, the Oakland Foundation has been very instrumental in helping people, older people, get on the list and actually have their list. I know that as of last week, they had stopped taking applications because they had over 2,000, and I'm not sure whether they have opened that back up now that we've been able to vaccinate some of those 2,000. So I would check with the different pharmacies website and also the Oakland Foundation. They've been really very helpful and very organized in terms of helping seniors get signed up and get their vaccination. So those would be the two main sources to look at getting on the list.
So recently, there's been a lot of talk about how it may be safer for people to wear 2 masks at once, and the CDC and other experts are researching the efficacy of that. What is your input on double masking?
I think it's good because a lot of the healthcare workers that are dealing either testing people or actually taking care of people routinely double mask. And what I recommend people doing to be kind of extra cautious, if they can kind of tolerate it, is get one of the KN95 masks and cover that with the regular surgical mask. I think that can generally provide more protection than certainly a single either cloth mask or the surgical mask.
Do you have any update on how our local schools are doing right now?
They seem to be doing well. We again on our Monday morning calls, we have representatives and usually the superintendent of all the 7 school districts in Garland County. And over the last 2 to 3 weeks, they've been reporting a decrease in the number of cases among students and the staff, and having fewer people quarantined. They certainly still have cases, but to my knowledge, none of our school districts have had to go to virtual only teaching, which is not the case in a lot of schools around the state. So we've had a really vigorous response by our educators, and I think we have a lot to be proud of here in Garland County of how the different school districts have really stepped up to make sure that it's safe for students and staff, but also still being able to do in-class teaching, which I think there's going to be a lot of studies done about the effects of the pandemic on the educational system, and show the importance of in-school teaching, certainly in the lower grades. But I think that I think all in all that we've done well here in Garland County.
And how about our hospitals? How's our capacity doing?
They've seen some decreases in January or towards the end of January. They were getting pretty stressed in the mid part of January when we were at our peak. But at our meeting on Monday, things had kind of leveled off, and had plenty of capacity. Excuse me, and we're doing well.
Well, since you and I last did a program, we have a new presidential administration. So I want to ask you a few questions about the new Biden administration policies. One of his first acts was to mandate the wearing of face coverings on federal property for 100 days. With part of Hot Springs being a national park, what does that mean for our city? For example, do people walking down Bathhouse Row have to wear a mask?
The park superintendent issued some kind of answering some of those questions, and I have not looked at that in detail. Certainly, all of the any kind of buildings on federal property, require masks, and I think that they're even going to, even on some of the outdoor areas, they're going to require masks. But I don't recall the specifics on that. I think it was actually in the paper yesterday or the day before.
The Biden administration also announced on Tuesday that vaccine manufacturers can now ship vials directly to pharmacies starting on February 11th, which would include Walgreens and CVS. What do you expect that would mean for how quickly people are going to get vaccinated?
I don't know. CVS and Walgreens have already been participating, and they were charged with doing the vaccinations in long-term care facilities. And to my knowledge, that went very, very well. I know that we have one representative from the nursing homes on our call, and that she reported that 98% of their staff had already been vaccinated. So I think that's moving forward well. As far as how the Walgreens and CVS are going to do their programs, I don't have any direct knowledge. You might, people that could certainly check the websites for both the CVS and Walgreens to see if they've set up some kind of a list or registration process. I don't know that they have yet, but I'm sure that they will in the foreseeable future.
The media is reporting that the White House is considering sending masks directly to American households. Do you know anything about this proposal, or might that even be something that Garland County would consider doing for our residents?
I'm sorry, sending masks directly to people.
Yes.
I don't have any knowledge about that. I think that that as opposed to early in the pandemic, where masks were hard to come by, I think there seems to be certainly a good supply of masks available. You can buy packages of them, and I know in pharmacies and I think a lot of other places, and certainly then kind of the specialty masks are the cotton or the cloth are certainly widely available. So I don't know the efficacy of that, and I don't really know anything about the actual program. But I think that there definitely no shortage of masks available right now.
I've got a question from Eric. What makes one vaccine more effective over another, like Moderna versus Pfizer?
Well, the Moderna and Pfizer vaccines are I mean, they're really essentially the same in terms of how they're structured. They use the messenger RNA to infect your cells, and then your cells, once the messenger RNA have gotten into them, they start spewing out these little fragments of the coronavirus. And then in your body kind of develops antibodies to that, and that's where you get the protection. So those two vaccines are very, very similar. I think maybe the coating that is on the actual messenger RNA is different, and I think that's one of the reasons why the Pfizer vaccine has to be kept at the super low temperatures, more so than the Moderna. But in the clinical trials with both of them, they both showed 90 to 95% effectiveness, and I think that's been really remarkable. I think when they're early in the process of developing the vaccines, I think people would have been happy with 60 to 70% effective vaccines. So when we were getting into the 90 to 95%, I think it was outstanding. And so I think it's there were really no big glitches in the clinical trials for those two vaccines. And now that we've had millions of doses given, again, there's as far as the reactions to the vaccine, and they're very the normal reactions is some soreness in the arm, and maybe some fatigue and low-grade fever for 24 to 36 hours. But as far as the severe reactions, I think they've been extremely rare.
I think we talked about this last time, but if for whatever reason someone getting their vaccine had a preference, would they be able to choose which one they get?
Would it not? I don't think you would from what I don't know that any pharmacy has some of both. I know that originally the Moderna was just mainly going to the long-term care facilities, and the Pfizer was going to the hospitals, and now into some of the community vaccinations. I think that the Moderna was being distributed by the CVS and Walgreens, and they actually had more Moderna vaccine than they needed for the long-term care facilities. So now that now some of the Moderna is going to the kind of general public. As far as whether I don't know that you can request one or the other. It's more dependent on what the pharmacy that you go to or the organization that's sponsoring the vaccination event has. And in terms of how good they are, there's really not any significant difference. The one difference is that, and they both require 2 shots. And the only difference is that the Moderna, you have to wait at least 28 days between vaccinations, and the Pfizer's it's 21 days. One other little difference is that The Pfizer can be given from ages 16 and above, and whereas Moderna is 18 above. Our clinical trials being done on younger people to see before they can be granted approval to give the vaccinations to younger people. But I think that I've heard that the trials for 10 and above are going well, and that they suspect that the vaccines will be cleared for that age group, fairly soon. Unfortunately, we're not going to have enough vaccine, and they'll be probably further down on the list of being eligible to get the vaccine. But at some point, there will be available for younger people too.
Got a question from Chaz. The CDC said schools are safe to reopen without vaccinating teachers. How does that make any sense? I thought teachers were the main concern there.
Well, I think I think teachers are, certainly. I would consider them, a high priority because it's so important to have our educational process move on. As far as at least in the state of Arkansas, they are pretty high on the list, being kind of in the top tier of the phase 1B. So I think it's definitely a priority to get them vaccinated. From the reports that we've gotten from the school districts in Garland County, is that they've had definitely positive cases among students and staff and teachers. But as far as the transmission, I think essentially in all the school districts, the cases have come from nobody's really caught the virus at school. They brought it in or found to be positive due to activities outside of the school system.
So the CDC also reported that only 38% of nursing home staff nationwide have accepted the vaccinations when offered, and 78% of residents have accepted the shots when offered. So a couple of questions there. Are we seeing similar acceptance rates locally, do you know? And are those numbers good enough?
Well, like I said, the only really actual report that I've gotten was one of the nursing homes here did report 98% of their staff had done it. I know at the governor's news conference, I think a week or two ago, that question came up, and he didn't have any specific percentages in Arkansas, and he said that he was going to look into it, but I haven't heard of any kind of any report on that. I mean, it's definitely a concern. I think that unfortunately there's a lot of anti-vaccination sentiment in all aspects of our country right now, and I think that's unfortunate because the vaccinations, that's been one of the big advances in medicine in the last 100 years, is development of safe and effective vaccines. And so one of my concerns about the COVID pandemic was that when we did get the vaccine, that a lot of people wouldn't take it. And I think that's probably being borne out in different areas. I know that even some of our, the law enforcement and first responders, there was some hesitancy about getting the vaccine. And one of the things that we've noticed here is that as people see other people getting the vaccine and with no side effects or minimal side effects, that the acceptance of the vaccine will be more widespread.
When the Department of Health reports the vaccination numbers, are they counting both the first and second doses of the shots separately, or does it take both shots to equal one vaccine number?
Well, they break it down, at least in some of the things that I've seen, that they kind of give you percentages of the. I think they give an overall numbers about the percentage of the vaccines that have been shipped to the state that have actually been administered, and then they have a separate designation for whether it's the first shot or the second shot, and so it goes into the detail. But the overall numbers are just total doses of vaccine, but they kind of define it a little bit better than that too.
And I do have today's chart from the Department of Health, if you want to take a look at that.
Yeah, I know initially there was a lot of concern about the vaccines not getting out, and I think there were some legitimate problems, and still are some of getting the vaccine to the places and getting they say the vaccine in the arms, and like see this shows that 61% of the doses that we received have actually been given in terms of the overall, and then the long-term facilities only 37%. So some of that is a little bit misleading because the places that do give the vaccine, they have like a 3-day period before they have to report that. So there's some lag in that. But I think that there's certainly a big effort statewide to work on the logistics of the vaccine and transporting the vaccine and making sure that it gets given in a timely manner.
How close are we to having a single shot vaccine on the market?
Well, it's the Johnson & Johnson vaccine, and it's in phase 3 trials, and I've heard that they'll have enough data to be able to present to the CDC and the vaccination committee within the next 2 or 3 weeks, and of course then the committee has to review their reports and look at it. So, but I've heard that it could conceivably be available, by the end of February. And there's concerns that it's in some ways it's more of a traditional vaccine. It doesn't use this messenger RNA like the Pfizer and the Moderna, and so it doesn't have the storage and transport difficulties that Pfizer and Moderna have. And I think it's also the manufacturing of it is a much simpler process than what the ones that use the messenger RNA are. So some of the early trials does shows that it's not quite as effective as the Moderna and Pfizer's are, but it's still effective enough. It's like I think they're looking at like 60 to 70% effectiveness, and we've kind of gotten spoiled with the idea of having 95% effectiveness. But if we can get the 60 to 70, that's felt to be adequate and be useful. And I think they're also since even it's being studied as a one dose, they're looking at the possibility of see if doing the dual doses like the others, whether that would bump their efficacy up into the higher range. But I kind of bottom line, I think it'll be here, with, like I say, within a month.
Deborah asked a question that most people have been asking for about a year now. Most annual events in Hot Springs keep getting pushed back. Is there a safe time in the future in 2021 we can expect events to be planned?
Oh, I think probably by the mid to late summer that I think our rates will be down. I think our vaccination program will be well under its way, and so I can see things being able to open up by mid to late summer.
Michelle says, I'm 71, high risk, and I've had my first dose and an appointment for my second. My only help is my 47-year-old son, but he's afraid to come over now. When will he be eligible for vaccination?
Oh, if it'll be a while. You know, I would say probably May or June or somewhere in that range. But it's just going to take some time.
What kind of preparation should people take when they have an appointment to get vaccinated, like time off work or any other precautions?
Well, I early on that we were seeing people after their second dose. So very few people have much in the way of reaction with the first dose. But the second dose, you do have a better chance of having more soreness and then having kind of generalized symptoms like fatigue, maybe low-grade fever, and so I think some places I've heard that when people are scheduled for their second dose, that they're scheduled to have a day off from work because there's a good chance that they won't feel like at 100%.
And it kind of sounds like some of the symptoms from the second dose can mimic COVID symptoms, so might be something to be aware of. I have another question from Chaz. Are the sanitation guidelines doing anything? You go to a drive-through and put your money in a cup. They take out the money, put it away, and put your change in a cup, which you then take back. I guess he's questioning that.
I guess I didn't understand the question.
Are the sanitation guidelines, like exchange of money, would you consider that an issue?
No, I don't. I think that, we were worried about a whole lot more about contact, early on in the pandemic, and I really haven't seen much lately that much of the virus is spread by contact. I just think certainly good hand washing and being careful with that is a good idea. But as far as contributing a great deal to the spread, I think it's really respiratory spread.
So surfaces aren't as much of a concern.
No.
What is the latest info on the new COVID variants, like the ones from the UK and South Africa? Can you hear me, Dr. Shelby? Uh-oh, did I lose you? Dr. Shelby, can you hear me?
I can hear you.
Did you hear that last question?
No.
Okay. What's the latest info on the new COVID variants from other countries like the UK and South Africa?
Well, I think there's some concern. The variant from UK, the way it shows up is that it's much more contagious and you get more spread. But it's also showing that the vaccine is equally effective against it, and also the treatment with like the monoclonal antibodies is as effective. The variant from South Africa, I think there's some concern that the vaccine may not be as efficacious, and that the monoclonal antibody treatment might not be as good. So I think there's more concern about that variant than the UK. But I think they're kind of looking out for that. We've not had any confirmed variant cases in Arkansas, but the health department is doing some surveillance, and they put out kind of some guidelines for physicians in terms of who needs to send their sample to the health department, and the health department will send it to the CDC, where they do the genetics on it to identify the variants. It's certainly expected that we'll see some of the variants here, but we haven't yet.
Would you say it's safe to assume they probably are already here?
Yeah, I think that's the consensus, that they're most likely are here.
variant I've heard the most concern about is the one from Brazil. Do you know anything about that one?
Nothing specific, but yeah, I know that there is concern that that the vaccine might not be as effective, and I think that you know they're actually I think the vaccine manufacturers are looking at they're either kind of doing something to the vaccine to kind of boost it so that it will be effective against these variant strains also.
So do we expect people to have to get boosters to protect against these or future vaccines or future variants? Sorry.
I'm sorry, I didn't.
Do we expect with all these variants that people will have to get boosters on top of their existing vaccines to help protect against these?
I mean, that's certainly a possibility. I don't think that they have really been able to do any kind of clinical trials. You know, it's just still early in even just the detection of these variants. So I think that there's definitely no specific guidance on that yet.
So I want to move on to testing for a bit. Are you happy with the testing accessibility here in Garland County?
I think so. That's one thing that we've been pretty consistent in terms of our numbers of testing done. We average around 3,000, 3,200 tests per week, and it's been pretty consistent with that. So I think there's widespread testing available through clinics, and certainly the health department is doing probably approximately 150 tests per week at the county unit. So I think that our testing is certainly available, and also there's more of the antigen testing being done at some at the health department, and even at the schools, they're able to do some of the antigen testing.
And you had asked me to share a list from the city's website of testing sites, so I'm putting that in the comments right now. So everyone will be able to find that, or you can go to the cityhs.net.
Right. They keep that pretty well up to date, and so I think that's to me that's a real good resource.
It's pretty well documented that the rapid antigen tests are not as accurate at detecting COVID as the PCR test. Why is that, and how much less accurate are they?
Well, I think that the positive tests are pretty accurate. I think they're getting fairly close to the PCR. The negative test is the antigen test just aren't as sensitive to pick up things as the PCR. I mean, the PCR is a very sophisticated test. You know, it's just dealing with the replication of the RNA. So unless you have the viral RNA there, it won't be positive. So there are very few false positives, and even not that many false negatives for the PCR. It's just that the PCR is just much more sophisticated test than the antigen test.
Will the current test be just as accurate when picking up the new COVID variants that have developed?
To my knowledge, it will be. Yeah.
The current recommendation is that if you're symptomatic and your rapid test is negative, to immediately have it followed up with a PCR, correct?
Yeah, that's certainly the way that they're doing it at the health department, and that's the current recommendation.
And someone who is symptomatic and waiting for a PCR test should quarantine even if the rapid was negative?
Yes, definitely.
So anyone who's had a nasal swab can tell you it's bearable but not pleasant. Could COVID be detected through a less invasive sample like saliva or urine?
Well, not in the urine. And I think there's some saliva tests, and even some of the testing is just a kind of it's not the nasopharyngeal swab where you have the probe that goes all the way to the back of the nasal cavity, where they just take the swabs from the forward portion of it. And I've even heard some places where they're doing kind of like throat swabs, like a strep test, and those are are effective too.
I don't know what sounds worse. So I want to do a last call for audience questions while I finish up my list here. So get those in. We're trying in around 7. If we get enough questions, we might go a few minutes over, but that's okay. There are 2-in-1 swabs that test for both COVID and flu, and I assume these are just as accurate.
With the single swab, I'm not familiar with those. I would assume that they would be. I mean, the flu swab is a nasopharyngeal swab too, so you're getting material from the same area.
If someone is feeling sick but their COVID result ends up negative, what are some of the common illnesses that have symptoms that may overlap with COVID?
Well, any kind of upper respiratory infection. The COVID-19 is a type of coronavirus, and coronaviruses I think there's thousands of them, and most of the viruses that cause common colds are these coronaviruses. So it's something that's everywhere, and the symptoms can be definitely overlap. So it's the same type of viral type infections that we normally have.
If you Google it, there's like 20 or 30 symptoms that people might experience that are on the list for COVID. And a lot of these symptoms, like headache or nausea, could be caused by anything. But what are the symptoms or combinations of symptoms that are more unique to COVID?
Well, certainly the loss of smell, taste and smell. And I think it's not really understood, why that occurs. But that's a very unusual, unique manifestation of a virus. As far as, but the other ones are, sore throat, fever, and fatigue, there's just a great deal of overlap.
If you're sick, kind of changing the subject a little bit, but if you're sick, you probably don't feel like drinking anyway. But is there any negative interaction between alcohol and COVID?
Not to my knowledge, except for, one of the things that alcohol does is it kind of acts as a diuretic. So you want to stay well hydrated with any kind of infection because your metabolism goes up. So that would be one thing that would be a cause of concern. Drinking alcohol while you're ill affects your state of hydration.
Are people who smoke or vape at a higher risk of bad effects?
I haven't seen anything like that. I mean, I guess probably theoretically anything that kind of damages your respiratory tract or irritates it would make it more susceptible to infection, and certainly smokers are at a higher risk for all kinds of respiratory infections from bronchitis to pneumonia. So it'd be reasonable to assume that they would be at higher risk, but I haven't seen any really specific studies on that.
And then other than, of course, being around people, are there any other activities that people shouldn't engage in if they have COVID that might worsen the effects?
No, I mean, for kind of mild symptoms of COVID, there really is no specific treatment. For people that have, the monoclonal antibodies, that treatment is really kind of reserved for people that are 65 and over and have mild to moderate symptoms. And kind of the main benefit of that is it kind of prevents it from becoming a much more severe illness. But as far as anything else, your body has to fight it off, basically, except for people that have the real severe cases of it that require hospitalization.
Is it true that you should avoid ibuprofen?
I've not heard anything about that. I don't know that there's any kind of cross irritation with that, so I don't think there's anything that I'm aware of for sure.
So the other day, KARK posted a sad article about an Arkansas teenager who's still suffering effects from COVID months later, including seizures and a blood flow disorder. Is this kind of on the extreme end of the aftermath, or are these kind of recoveries more common than we might expect?
Well, I mean, I don't have access to any kind of particular numbers, but I mean, there are a number of people that have long-term symptoms, and it's a significant number of people that 3 or 4 months out, they're still having fatigue and headaches and just feeling bad. And again, this is a new illness. And it's certainly a highly studied illness, but as far as the long-term effects, it'll be a while, because it does some things that you're not expecting from a respiratory virus. It can cause these microscopic blood clots. It can cause asymptomatic heart infections even. That there have been certainly cases of athletes that have had COVID, and unbeknownst to them, it had affected their heart muscle, and when they started vigorous exercise again, it really showed up. So, and then there's kind of the super inflammatory response in a few children that have gotten it. Again, that's a real unusual manifestation of the disease, but that's one of the things we're seeing for sure.
Well, last question or two for me. In a previous update, you and I had discussed how the pandemic has been disproportionately harmful and deadly to communities of color. And the latest statistics are that non-white people are 2.8 times more likely to die if they get COVID. So I kind of have two questions there. How are our local Black and Latino communities doing? And two, do you have any updates on what Garland County has done to help combat that kind of healthcare inequality?
I don't really have any specific information. I know, like in the Hispanic population, early in the pandemic, say like back last June, July, we were seeing in the part of the database that I have access to a higher than normal percentage with Hispanic names, and we had a couple of Hispanic nurses that joined our task force and really did a great effort to inform the Hispanic community about the virus, and in the health department has done a good job of making sure that all of our announcements and warnings are available in Spanish. So I think that was concerned early on, but we had some really good, strong local leadership in the Hispanic community that really we saw a significant drop in the percentage of Hispanic that were positive after their efforts. I don't have anything specific as far as the Black community. I think one of the things about the disparities is that this is pointed out is that there are.
Well, we lost him. Well, give him just a moment, see if he's able to join back. Maybe his device that he was on died. Sorry about that, audience, but that was the last question. If we're not able to have Dr. Shelby back, I will give him just a moment to try and join back in. And if he's not able to, we're aiming for our next update on Thursday, March 4th, and we'll make an official announcement about that in the coming days, but might have lost him. All right, well, thank you everyone for watching, and thank you, Dr. Shelby, for everything, and everyone be safe and take care.